Hello, everyone, and thanks for joining our webinar on the Dimagi Vaccine Solution. Let's get started. In today's webinar, I'll start by introducing the speakers from Dimagi and tell you a little bit about our company. Then I'll walk you through the Dimagi Vaccine Solution and the challenges it solves. We'll then focus on the data interoperability standards and integrations that are included in the solution. Finally, we'll share some of what we have learned about deploying the Dimagi vaccine solution at national scale in Jamaica and Somalia. My name is Khwaja Zuhaib Husru, and I'm a technical project manager at Dimagi. I work out of Dimagi's office in New Delhi, India. I'll be taking you through the Dimagi vaccine solution and introducing our data interoperability standards and integrations. My colleague Yuliswa Matu is an application engineer working out of Dimagi's office in South Africa. He will provide a demo of one of our integrations within the Dimagi vaccine solution. Finally, my colleague Akash Lohi is a project analyst. He also works out of our office in New Delhi, India. Akash will share insights from two case studies where the Dimagi vaccine solution has been deployed at national scale. While the three of us will be speaking about the Dimagi vaccine solution today, we are part of a much larger team that designed, developed, and deployed this solution. We're excited to share what our team has accomplished together. Let's get started. At Dimagi, our vision is ensuring that people have the services they need to thrive. And our mission is building digital solutions that help us get there. For this webinar, we'll be focusing on vaccinations as an essential public health service. Before we zoom in to look at our vaccination work, it's helpful to understand the history of our team. We have worked on over 3,000 projects in over 130 countries with over 1 million frontline workers. We are proud of the impact we have had to date and encouraged by the impact growth we continue to see. We brought this experience and passion for impact to our design of a solution for vaccination at scale. Now let's spend some time understanding the Dimagi vaccine solution. Why did we think a vaccine solution was required? What are the key challenges we are trying to solve? As you have likely observed in your own setting, we have seen massive disruptions to immunization since the onset of the COVID-19 pandemic. During the height of the pandemic, clinics were closed, health workers and resources were diverted to COVID-19 response, and social distancing requirements made it difficult to organize vaccination camps. Even after the introduction of COVID-19, vaccines and a slow return to normalcy, immunizations are lagging behind. In 2021, 25 million children less than 1 year of age did not receive their basic vaccines. This is the highest number since 2009. Unfortunately, we don't expect this trend to change anytime soon. The World Health Organization has warned that the slowdown is likely to continue as countries respond to COVID-19. Given the importance of vaccines in preventing disease and promoting health, Dimagi felt moved to design a solution that could help countries balance the sometimes competing priorities of COVID-19 and routine immunization, without one coming at the cost of the other. The result of this design work is a three-part solution that brings frontline workers, clients, and administrative staff together on a common platform to manage immunization at scale. Frontline workers have an application to register clients, deliver services, and do community outreach. Clients have a dedicated messaging channel where they can get updates about their vaccination status and report feedback. Administrators have access to a dashboard and analytics to monitor immunization progress across levels. Since the Dimagi vaccine solution is built on CommCare, it also enjoys the features of a solution designed for service delivery at the last mile. The solution works without an active internet connection, can be translated into any number of languages, utilizes all open source components, and includes rich multimedia to help low literacy users with application navigation. In addition to these specific features, the CommCare platform has been proven at scale, making it possible to deploy the solution at a national or cross-national level. Before we look at the specific workflows within the solution, let's start with an overview of the solution's functionality. There are 6 main components of the solution, each of which addresses a different immunization challenge. Each component is built independently of the others, making it possible to pick and choose the part of the solution that are relevant. For example, a partner could choose to use only the first, second, and fourth components of the solution. We'll go through each of these 6 components in detail in the subsequent slides. The first component of the solution is the client registry, and this is the engine behind all of the other workflows. Clients can either be registered in the application directly or pulled into the system through an integration with an external system. Client details like age, sex, and occupation are used to calculate vaccine eligibility in other parts of the application. Using data from the client registry, the dashboard provides an overview of the number of clients that have been registered, along with other program indicators that are pulled from the solution components we'll review in the coming slides. The second component of the solution is vaccine delivery. By default, the vaccine delivery workflow uses the World Health Organization's standard vaccination schedule to check for eligibility. However, partners can replace the vaccination schedule with their own requirements through a simple Excel file upload. The workflows will automatically calculate eligibility criteria based on the partner's vaccination schedule. Using vaccine delivery data, the dashboard shows a summary of how many vaccines have been delivered along with a vaccination status and drop-off rates for a client population. The third solution component is adverse events following immunization. This workflow is used to report and follow up on adverse events. For example, a client can report via SMS that they experienced a severe reaction to vaccine. The corresponding frontline worker is assigned a task to follow up with that individual to investigate the adverse event. This is a really important part of vaccine program management because adverse events can be a primary cause of vaccine hesitancy. By investigating adverse events and counseling clients about the experience, program can minimize the effect these events have on levels of vaccine hesitancy in a client population. At an aggregate level, the dashboard summarizes the number of adverse events reported with a breakdown by the type of side effects that was reported. This information can be bifurcated by the type of vaccine and client population to understand trends. The fourth solution component is community mobilization and counseling. As you have likely seen in your own communities, vaccine hesitancy is a major challenge. With increasing skepticism towards vaccines, there is a risk that people will opt out of receiving vaccines, even if there are sufficient doses to cover a client population. This workflow is designed to help frontline workers build vaccine confidence through targeted counseling and to mobilize a community by reminding them of follow-up appointments. The dashboard visualizes the community mobilization events and counseling activities completed by frontline workers. For program administrators, a feedback loop from the community is critical. Therefore, the dashboard also summarizes the reasons for vaccine hesitancy that were reported by frontline workers. This allows administrators to plan public health messaging to address the most prevalent reasons for hesitancy. The fifth workflow is facility management and stock monitoring. As we all know, even if we address vaccine hesitancy and mobilize clients to visit a clinic for vaccination, All of this goes to waste if the facility isn't equipped to administer the vaccine. This workflow allows facility managers to complete self-assessments of preparedness for vaccination activities and to report on stock availability. At an administrative level, the dashboard reports on stockouts and oversupply to assist with stock balancing across vaccination sites. The sixth and the final workflow in the solution is health worker training. This workflow includes pre-built training materials that are drawn from internationally recognized bodies such as the World Health Organization. While these materials are a good starting place, the real value of this workflow is the ability to quickly roll out new training materials to health workers as policies and guidelines change. For example, as we saw with COVID-19, our knowledge about the virus and immunizations changed rapidly. This workflow makes it easier to disseminate information through an established and controlled channel of communication. It's particularly important given the prevalence of misinformation about vaccinations that has been observed since the start of the COVID-19 pandemic. Now that we have taken a look at the Dimagi Vaccine Solution workflows, we'll also describe how it has been designed for interoperability and integrations with external systems. I'll start by giving you an overview of the standards we follow, after which Yuliswa will provide you a demo of one integration. Interoperability. In order to ensure interoperability of the Dimagi vaccine solution, we are compliant with the World Health Organization digital documentation of COVID-19 certificates, vaccination status. This standard specifies the core fields that all vaccination data sets should contain. This standard allows us to exchange data across systems and ensure that clients experience continuity of care and are able to prove their vaccination status even if they move across systems. Integrations. We also recognize that in order to add value to partners and clients, we need to be able to integrate with external systems. In particular, an important integration capability is the ability to generate vaccine certificates on recognized systems. For this reason, the Dimagi Vaccine Solution is integrated with the digital infrastructure for verifiable open credentialing DIVOC, a widely accepted vaccine certificate portal and a DPGA listed public good. We'll go through each of these standards in more detail in the subsequent slides. The WHO DDCC VS standards are a set of requirements specified by the World Health Organization that allow data exchange of COVID-19 vaccination status. This means partners using the Dimagi vaccine solution are collecting data in compliance with WHO DDCC VS standards. In compliance with the WHO standards, all data fields within the Dimagi vaccine solution are mapped to the DDCC VS standard. For example, you can see in the screenshot that the register client form is being used to register a client name Raman Singh. At the backend, the Dimagi vaccine solution property is mapped to the DDCC VS property to facilitate data exchange. As another example, in the screenshot, you can see that a client received 2 doses, OPV dose 1 and DPT dose 1. The table on the right-hand side of the screen shows how the data fields from the Dimagi vaccine solution have been mapped to the data requirements specified by the WHO standard. As mentioned previously, it is important for clients to be able to access their vaccine certificates once they have received vaccinations. We have integrated with the DIVOC vaccine certification system to enable this functionality for clients. Within the Dimagi vaccine solution, frontline workers administer and record vaccinations using the vaccine delivery workflow we spoke about previously. Thanks to our integration with DIVOC, clients can then use the DIVOC portal to download their vaccine certificates. Yuliswa will show you what this looks like in practice in a short demo.
Thank you, Zahir. Hi, I am Yuliswa, an applications engineer at Dimagi. I have worked in a technical capacity on this project, creating the integration between CommCare and DIVOC so as to create digital vaccine certificates. I'll now switch my screen over for a small demo so you can view the integration in action. We will now register a new client to the system using the CommCare app. This is a screen grab of my mobile device. As you can see, the app gathers all client information that is needed for compliance. The phone number field is very important to us, as this is what is used as the unique ID for the end user to log into the DIVOC system. And now choose which of the COVID-19 vaccinations our test user will receive. This here screen creates the appointment for Monday to receive vaccination, which I will set to today. After they are registered, you now will use the administer vaccine dose functionality to administer dose. And confirm that the dose has been administered. You now need to enter a date that will serve as the next appointment. This is DIVOC that recipients can use for themselves from a computer or mobile device so as to access their certificates. See, we use the mobile number to log in. The vaccination certificate is then displayed, bearing the recipient's details. It can then be downloaded in different formats as per user needs. I'd like to thank you for listening and hand over to Akash now for further insights on the project.
Hello everyone, I am Akash Lohi. I really appreciate everyone for sticking with us for this long. We are now at the final section of the webinar, which is looking at the two case studies where the Dimagi Vaccine Solution have been deployed at the national scale. In 2021, Jamaica and Somalia deployed the Dimagi Vaccine Solution at national scale to manage their COVID-19 vaccination programs. Due to the tireless effort of these countries, supporting organizations like UNICEF and the World Health Organization, and dedicated frontline worker, over 2.9 million COVID-19 vaccination doses have been recorded and using the Dimagi vaccine solution. Now let's start by taking a closer look at Dimagi Vaccine Solution deployment in Somalia. The solution was launched in March 2021 in order to distribute these vaccines that were allocated as part of COVAX facility. Approximately 500 users were onboarded to this solution, and over 1.5 million doses were recorded. Administrator in Somalia chose to visualize data on a Power BI dashboard for which they were able to utilize at integration between CommCare and Power BI to pull in data. Our second case study took place in Jamaica, where the Dimagi Vaccine Solution was developed for 2 months after Somalia in May of 2021. The Jamaica deployment had approximately 1,000 users and recorded nearly 1.4 million COVID-19 vaccine doses. In this program, administrators choose to visualize data on a superset dashboard, again utilizing CommCare integration to extract these data. Our partner in Jamaica shared that the CommCare platform in Jamaica create the formula the world can learn from. In spirit of carrying forward learning from this case study, I will be sharing some of our key takeaway from the final slide. Our first learning is that having a digital accelerator in place can help partner get off the ground quickly. The Dimagi vaccine solution was developed in late 2020 before COVID-19 vaccination were even available. By having a system in place at a starting point, partners like Somalia and Jamaica were able to deploy the solution quickly once they received their allocation of COVID-19 vaccines. Second, we continue to see the importance of interoperability with other systems. In Jamaica, the government had a separate portal which was used to register the vaccination appointment. The interoperability of the Dimagi vaccine solution was critical to ensure that we could receive information from the appointment scheduler portal and follow up on these appointments within the solution. Third, we work closely with other leaders in our sector to adopt common standard to ensure the collaborative response. For example, we worked with Medic Mobile, a partner in our sector, to ensure that the system we designed were compatible with each other. As an extension of this work, we also rely to international standard by the WHO to ensure that our system is compliant with standard that our partner will expect to meet. Finally, we learned while digital accelerator add value and speed up work in early days of pandemic, we should anticipate and plan for changes. When the system was rolled out, the maximum number of COVID-19 doses any individual could receive was 2. Now we have a concept of booster dose. Also hadn't started exploring the possibility of mixing vaccine doses by different manufacturers. Now, an individual can get Pfizer vaccine for their first dose and Moderna vaccine for their second dose. As our deployment matured, the system was adopted to accommodate these changes in immunization guideline and reality. Thank you for your time today. If you would like to learn more about the Magi vaccine solution, check out our webpage on CommCare for vaccine delivery. You can also write to us at vaccinesolution@themagi.com.